Hello, and welcome to Chronic Lymphocytic Leukemia High Impact Topics, Testing, Targeted Treatment, and Side Effects. In this video, we'll look at recent advances in CLL care, the newest treatments, the latest tests, and the strategies doctors are using to ensure that CLL patients achieve the best possible outcomes. Let's dive in. After you've been diagnosed with CLL, your doctor will conduct tests to determine how aggressive your disease is and identify what treatments will be best for you. One of these tests is fluorescence in situ hybridization, better known as FISH. Using a sample taken from your blood, lymph nodes, or bone marrow, FISH looks at your chromosomes, that is, the structures in your cells that contain your genetic information, to see if they have undergone any changes. These include translocations, which is when pieces of different chromosomes swap places, deletions, which is when a piece of a chromosome is missing, and hyperdiploidy, which is when the number of chromosomes is higher than normal. The most common chromosome changes seen in CLL and what they mean for your disease course are shown here. Your doctor may also perform DNA sequencing, which looks at your DNA to see if any changes or mutations are present. DNA mutations can also help your doctor determine how aggressive your disease is. For example, whether or not a gene called IGHV is mutated can have implications for your disease course. If your IGHV gene is mutated, you will likely have less aggressive disease and go longer before needing treatment than if your IGHV gene is not mutated. Mutations in the Notch1 and TP53 genes, on the other hand, are associated with poorer outcomes. If you're diagnosed with CLL but have no symptoms, your doctor will most likely monitor you to make sure the disease does not advance. Treatment is generally started only when you develop symptoms that affect your quality of life. In recent years, several new treatments have emerged for patients at all stages of CLL. These new treatments are able to attack CLL cells specifically. This is called targeted therapy. When deciding what treatment is best, your doctor will consider a number of factors, such as what the results of your FISH and DNA sequencing tests were, and what stage your CLL is. Your doctor will also look at your age, health, and ability to perform daily activities without help. Your treatment goals are also something that your doctor will take into consideration. And, of course, details about the treatments themselves are also important, such as their side effects and whether your treatment will be for a set amount of time or given indefinitely. For CLL treatment, several drug regimens are available. Acalabrutinib, zanubrutinib, and ibrutinib are Bruton tyrosine kinase or BTK inhibitors, a type of drug that blocks the growth of cancer cells. These drugs are oral agents that can be used by themselves or in combination with other agents. Venetoclax is a B-cell lymphoma 2 inhibitor, a type of drug that disrupts a protein in cancer cells, causing them to die. Other agents often used in combination with other CLL treatments are rituximab and obinutuzumab. These drugs are immunotherapy agents that help your body find and fight off cancer cells. Finally, another treatment option that may be appropriate for CLL patients is participation in a clinical trial. Now, let's look at the potential side effects of CLL treatments and some of the strategies for managing them. Because ibrutinib, acalabrutinib, and zanubrutinib are all BTK inhibitors, they tend to cause similar side effects. These include diarrhea, infections, second primary cancers, pain and stiffness in the joints, irregular heartbeat, high blood pressure, increased risk of bleeding, and decreases in the level of some blood cells. The risk for these side effects will depend on your specific risk factors. For example, whether you're taking an antiplatelet or anticoagulant drug. Some of the side effects associated with venetoclax are similar to those seen with the BTK inhibitors, for instance, low blood counts and infections. However, a condition called tumor lysis syndrome can also develop. In tumor lysis syndrome, cancer cells break down and release toxic substances into the blood, which can lead to organ damage. If you receive venetoclax, your doctor will monitor you to prevent tumor lysis syndrome. You may also receive intravenous fluids and medications that can reduce levels of some of the toxic substances released in tumor lysis syndrome. For mild side effects, your doctor may recommend strategies for controlling the symptoms. For example, advising you to stay hydrated if you experience diarrhea, or to take an over-the-counter pain reliever like acetaminophen for joint pain. When side effects are more severe, your doctor may reduce the dose of your CLL drug or pause your CLL treatment until the symptoms resolve. In some cases, your doctor may switch you to a different CLL therapy. Strategies for managing CLL have advanced significantly in recent years. Our understanding of the disease has expanded, leading to the development of not only new treatments, but also new tests that help determine a patient's prognosis and guide his or her treatment, and new strategies for preventing or minimizing treatment-related side effects.